The Masonic Medical Research Institute was founded in 1958. Its purpose was to try to treat and find cures for all humankind and all diseases. Since then, we have actually excelled in the area of cardiovascular research, and currently our programs are now expanding outside of the cardiovascular research space to encompass areas in autoimmunity, neurological disorders, gastrointestinal diseases, and cancer. When I first arrived here, I think one of the most compelling reasons I came was because of one of our board members, and he said, don't look at the space for what it is, imagine what it can be. And I think that moment for me was the reason why I decided to come to MMRI. Being able to build something in a vision of a scientist is an opportunity of a lifetime. Being able to grow this into a space that has state-of-the-art equipment, recruiting top talent from all over the world to a small community here in Utica, New York is unbelievable. We have all of our resources available at our fingertips. We have the opportunity to do cutting-edge science, state-of-the-art research opportunities, and really kind of make a difference.
Here, having it be a small institute allows us to, A, have access to all of the equipment immediately, so it actually facilitates our jobs, and B, it's also the fact that there is a chance for us to kind of set the groundwork for a successful institute. And so all the faculty that have come so far have the capability to kind of put our fingerprint on the development of the Institute.
We have excellent collaborations, opportunities with colleagues here at the Institute as well as the environment, local community.
Science doesn't exist in a silo anymore where a given team is taking a project from start to finish, but instead working in large collaborative teams together to really bring something perhaps from my expertise, which is genetics, through to hopefully the bedside for bringing therapeutics to patients.
I don't think MMRI is just keeping up. I think we're leading. When I first started here in genetics, we used to screen one gene at a time. We then went to gene panels where we could screen 80 genes at a time, to now we can actually screen whole genome.
The thing that I really liked about MMRI is the close-knit collaboration that happens here. That's possible because of the smaller size. And also the visionary leadership that Maria has brought into MMRI is really a big attracting factor for me to come down here.
Bringing Dr. Kontaridis on board has brought significant new life. The scientists that she has brought are dynamic, young, aggressive in their field, well-known, and are attracting research and research dollars from around the world.
And without the contribution of the brothers and the members of the different bodies of the fraternity, we could never have a facility like we have here today and what we are planning for the future. We need their backing and we need their financial support as we move forward with what is about a $15 to $16 million renovation project that is nearing its completion.
We want to do something for humanity, not necessarily for ourselves, but leave a legacy that will have an impact on generations to come.
If we can broaden our vision out with the number of diseases that we've been studying. In the past, it was merely cardiac problems, cardiac pacing problems. Now we're working with diabetes and obesity. We're working with lupus. We're working with autism. And so it's a much broader base. And I think if we expand that out, given our resources, we'll expand as well.
In the last year and a half, we've actually recruited 30 more scientists to the Institute, which makes us an outstanding research enterprise, and we hope to continue to grow to at least 100 in the next couple of years. Many of us are affected by family members or friends, or ourselves in some cases, with the diseases that we're studying here at MMRI. We're interested in cardiovascular disease, we're interested in autism, we're interested in gastrointestinal diseases, and we're interested in autoimmunity. All of these are things that sometimes affect all of our lives, and many of us can become very familiar with these things on a personal level. For us as scientists, I think it's an opportunity to take these diseases and take them a step further, combat those diseases, and figure out ways that we can try to treat them.
My hope is that we will be the world-class research facility that we are destined to be as we move forward with our current plan. This is what research is all about. Research is assisting humanity.
It's an investment in the future because what's going on here is going to change the direction of what's happening in the future.
We think that research is the first step in finding a cure to diseases. We think we can imagine a world without autism, imagine a world without lupus, imagine a world without cardiovascular disease, and imagine a world without diabetes and obesity. We should be able to find ways that cause the disease, treat the disease, and hopefully eventually find cures to those diseases. We're going to be state-of-the-art, cutting edge, and moving in a direction that's going to push the field and not follow the field.